My name is Jerome Evans, and I'm one of the co-chairs of this committee. I'd also like to introduce our other co-chair, Laura Rangard. Laura, go ahead and wave. Awesome. Before we begin, I'd like to note that this meeting includes the remote participation of members as authorized under Minnesota Statutes Section 13D-021 due to the declared local health pandemic. I will now call this meeting to order and ask Hattie to call the roll so that we can verify the presence of a quorum. Go for it, Hattie.
Terry Ann Jones is not able to be with us tonight. KJ Starr. Mary Pike.
Present.
Kozar Mohammed. Lisa Nakotra.
Present.
Anna Arkin. Anna Arkin.
She mentioned that she
Away.
wanted.
Yeah, she's away today. Yep.
She's going to be late, is that what you said?
She's not going to make this one.
Oh,
She
she's
emailed
not.
a couple of weeks ago, I think.
Thank you. Fatima's not going to be here. Alicia Jackson.
Present.
Laura Rangard.
Present.
Jerome Evans.
Present.
Andrew Crook.
Here.
Britt Culp.
Present.
Wanda Felder. Wanda Felder. Meredith Martinez.
Present.
Craig Hedberg. Craig Hedberg. Babette Abland. Craig Hedberg. Sorry.
Here.
And I heard Babette.
Yes, I'm here.
Aaron Hurley. Aaron.
I'm here. Is anybody else getting feedback? I hear like water or something.
Yep,
Yeah, I
static,
do too.
white noise.
Okay. Yep, I'm here.
And Jolie Punjabi. Did you say she wasn't going to be here, Margaret?
No, I'm here.
Oh, you're here. Okay, good.
Yeah, I
All
had
right.
made a mistake.
We have 12 members, and that's a quorum.
Wonderful. Okay. I do hear that feedback, so everybody mute, and we'll try to see if it's me. Okay. Patty?
I'm trying.
Oh. Oh no, Hattie, it was you. Well, everyone, we are going to go through the usual discussion of the agenda and the minutes, and then have a roll call vote on them again. So Aaron, I apologize. Hattie will need to unmute to approve the agenda and the minutes. So before we go, if you have any questions on the agenda or the minutes, you may unmute and let us know. Okay, seeing none. Aaron, I'm going to ask that you unmute and motion to approve the agenda and the minutes.
I move to approve the minutes as written.
And the agenda, wonderful. And then Britt, would you mind seconding? Oh, unmuting and then seconding, please. Anyone who is not muted may second.
Second.
Andrew Crook. All right. Thank you very much. And then Hattie, please.
I'm sorry, I lost my screen for a second, so I'll third everything as well. My bad.
That's just the way things go in these meetings. It has to happen at some point. Hattie, please take the vote.
Okay, are you still hearing that noise? It must
Yes.
it must be my headset. Okay, KJ Starr. Mary Pike.
Yes.
Kozar, Lisa Nakotra,
Approve.
Anna Arkin. No, she's not Anna. Alicia Jackson,
Approve.
Laura Rangard,
Approve.
Jerome Evans,
Approved.
Andrew Kirk,
Approve.
Rick Culp,
Approve.
Wanda Felder. Have you joined us yet? Meredith Martinez,
Approved.
Craig Hedberg,
Approve.
Babette Appland,
Approve.
Aaron Hurley,
Approved. Can I make a suggestion, just in the interest of being helpful? If you have a input setting, Hattie, try adjusting that. You know, so if you have a like a system, you know, if you adjust the sensitivity down, that might fix it for you. Just
thank you. I'll try that.
Yep.
And Julie Punjabi.
Approve. Sorry, I couldn't find my unmute button. Approve.
I think we're all having technical problems. Okay, that's carried.
Wonderful. Congratulations, everyone, on the first test of the meeting, which is finding your unmute button. Well done. Well done. We'll now carry over to the next item on our recently approved agenda, a presentation on food security and food access initiatives in the health department. Our presenter is Tamara Downs Shui. Please correct me if I mispronounce that name. First, I'll ask Margaret if she has any introductory words for the presentation, and if not, then our presenter can take it away. Oh, Margaret does not have any words, so take it away, please.
Hello, everybody. One moment as I pull up my screen. Are you able to see my slide?
Yes.
Excellent. Well, it's great to be here with you tonight. My name is Tamara Downs Shui, and I am. It's a tricky. It could go any direction with this name, and really great to be with you all as the staff for the Food Council. I don't often get the opportunity to go and sit with other like-minded folks and hear what discussions are happening. So I appreciate the invitation, and certainly am eager to hear any questions or alignment in the work that we're doing with the Food Council as well as within Homegrown Minneapolis at the Health Department. I should add that I was situated in the Sustainability Division of our coordinator department up until mid-year last year. And so I am still feeling like a recent colleague of Margaret and the Public Health Advisory Committee, though we've been longtime collaborators in this work. And so great to be situated now in the same department, but still really seeing our work as cross-enterprise with sustainability an integral part of the way that we see the work of Homegrown. So I'll just spend a bit of time on the background of the initiative and some of the key projects that we have been working on, and really end with that discussion on food security and our food action plan, which is our aspirational process that has taken a little longer than we had originally anticipated to try to help the city move forward some important food systems work. So Homegrown Minneapolis is a city community partnership, which is intended to expand the community's ability to grow, process, distribute, eat, and compost more healthy, sustainable, and locally grown food. And it was launched, which now feels like way back in 2008. And that is when we had a process that included a lot of input and a lot of city departments and policymakers, and some recommendations that now are a little bit stale and needing some updating, and some that are still as relevant as ever, and a really very immense body of work that occurred in that process to change a number of rules in the city, including being able to grow and sell food, and a lot of ordinances and policy kind of code language related to the urban agriculture priorities that folks expressed, and also around farmers markets were kind of two of those central areas of work, and the Food Council itself being created as a product of that process. Launching in 2012, I've been its full-time staff since 2014 when the role was added, and that is a 25-member group. Like yourselves, it includes community members, 17 of them. 15 are appointed by the city, 1 appointed by the park board, and 1 appointed by the school district. And then we have 6 representatives of the city that include a mayor's rep, a city council member who has been Councilmember Jeremy Schrader for these last few years, and then also a parks and a school district staff as well, to try to be at the same table together to consider what those policy needs and implications may be. And so a good portion of the work that I'm involved in is working with the Food Council to try to move food system initiatives forward. And additionally, we'll circle back to the Food Council toward the end here. The Farmers Markets of Minneapolis is both a name that has been created to talk about all the farmers markets operating in Minneapolis, as well as an actual collaborative effort that I've been really honored to be a part of. As many of you may know, we have a lot of farmers markets around the city, some areas less represented by farmers markets than others, and some much longer in their tenure than others. And they're all, with a couple exceptions, independently operating. And so it's been since 2015 that we've been meeting across the city with different farmers markets taking the lead off and on throughout these years in together identifying a strategic plan and some data gathering efforts that have been in partnership with the University of Minnesota since 2015 or early 2016. We have together co-designed now a template that's being used in many parts across the state for gathering input from customers, vendors, and market managers to be able to tell the story of the impact of the markets. And this was really, I would say, in large part catalyzed by the West Broadway Farmers Market manager going to an international conference, coming back, and also in concert with other managers saying we want to be able to get more support and tell our story, and we don't really have a good way to talk about the numbers, why these markets matter. And so together we approached the University of Minnesota, and we're really excited that there was a new faculty member just joining the U named Hikaru Peterson in the Applied Econ department, who we've worked together with since that point in time to be able to help the markets tell their own stories. I would say, you know, West Broadway is one example. The Four Sisters Market has a really great anecdote about their ability to show how they are actually the shortest distance traveled of any market, because they have so many of their products coming from local urban farms in the neighborhood that they, I think, less than 10 miles is their distance. And as a whole, these markets have been able to show not just the 16 million in vendor sales in 2019, but less than 40 miles traveled from farm to market for these markets on average. And so really hyper-local marketplace that is working together to really identify how they can be more sustainable and offer even more opportunities for the customers to stretch their dollars and those vendors to have more opportunities. So that's been an ongoing initiative that's had to, of course, like everything else, have some pivots and pauses over these last couple of years, but I'll say on their behalf that they've been able to continue operating when markets in other cities around the country had to pause. This group of markets really was really taking COVID precautions seriously, and also its role as a marketplace in offering those opportunities for vendors without shutting down. And so really a lot to say on their behalf to keep those markets going tenaciously through the last couple of years, and really excited to keep working with them to be planning toward the future and how we can ensure that, you know, the folks who want to be a vendor in our marketplace and and those who want to be able to shop at a market have even more ways to do that affordably and accessibly in these next years. So certainly we'll happily answer any questions on the markets later on, but I will move on to our urban ag efforts. These really did kind of germinate during that homegrown Minneapolis process, with the foundation of the garden lease program being, I think, about 20 lots that were leased when I came to the city back in 2014. And now we have about 60 city-owned lots that are leased for community gardens and market gardens, with our main challenge being, as many of you may know, really the land being owned by the city, held mostly in our housing division, and about 10 of the lots in the public works department. And those that are made available in those areas that are owned by the housing division and CPED are facing the challenge of the development that will be needed and possible for that land that has opportunity for some really I think large amounts of incentive programs and priorities to develop affordable housing, and a conversation with the community on all sides here to try to identify how we can maintain access to land for growing food and a livable community, while also really addressing the housing crisis that we know is simultaneously challenging for the community. When we're looking at growing food or growing housing, it's certainly difficult to be trying to weigh one versus the other. And we're really, I think, able to give a lot of credit to the Food Council and to the community members who have put their heart and soul into advocating for those 60 city-owned lots to be made available to the community. When community members have said, you know, this is publicly owned land and it's sitting real fallow and really collecting rubbish and other types of activity that are not favorable to the community, we've really worked together to try to make those lots available for people to grow vegetables that are native to their own cultural traditions, that are ways for them to learn about permaculture, teach other family or community members, and really pass on traditions or learn new ones and build community together. So we know there's a lot of outcomes that are difficult to measure, that really kind of embody these different dimensions of public health that to community are so important and spiritually and culturally. And so I will say that this is a program that is continuing, but we are looking at how it may continue evolving to meet the needs of community, as well as the constraints and challenges that we face with how that land was originally acquired by the city, and how we can work to meet the needs of folks wanting to grow food near where they live. And again, happy to answer more questions about that later on. We do make the lots available for lease on an ongoing basis, with applications offered in the January through March time period for any new lots that have become available or newly available if lease has not been continued. So we'll be advertising that shortly in the new year. The passive solar greenhouse pilot project is something that has taken longer than planned, kind of like our food action plan, where we started this project, and really what we're really eager to learn through this is what energy use may look like in a passive solar greenhouse setting in the city, and how effective that can be for a year-round growing, and what those zoning considerations may be. So I've been really honored and happy to partner with our community-based organizations, Tamales y Bicicletas and Appetite for Change, along with architect from the University of Minnesota and the Center for Sustainable Building Research, to work with these community partners and look at what their needs are as far as the growing in their neighborhood in a year-round way, and how to do that affordably and accessibly, and in a way that will have less energy impact. And so again, this is something we'd hope to complete a little bit sooner than now, but these projects are just coming to be online to be able to do this production and studying what that energy use looks like. So stay tuned for more on that, and really excited to be able to be exploring how we can look at year-round growing and what those zoning and building code and kind of city involved or kind of stand out of the way type of implications are for folks who want to have more food sovereignty and ability to grow food in their neighborhood, not just in the summer, but in ways that would help them have access year round. So, food security really has become a large focus of the work, and in a way that it always has been, but over the last couple of years, pre-pandemic, actually, we were really in a situation where we knew that SNAP, there were so many different policy implications to the challenges people were facing to continuing their access to food support programs through the federal government, in ways that it may be harder and harder over those last years to have been eligible or to feel comfortable and safe in going and self-advocating for participation in those programs. So it's already been a few years that we have taken a more involved role as an initiative and a food council, and with our limited capacity and trying to understand what might be a city role in advocating for food security support for folks. And we are really fortunate in this area, not just to have this large philanthropic network and community, but the Food Bank, Second Harvest Heartland, and the Food Group and Hunger Solutions as an advocate have been doing so much to both advocate at the state and federal level, that really have been working to understand where it makes sense for us to plug in and what the city can do as a partner and somebody who, when it makes sense, shows up to try to see where the gaps are and help to fill those. And so going into last year, we already were seeing that surge and hearing the surge directly from folks who are in our food shelf network in the city. And we've had a map on our website for a number of years, but what we saw immediately when this map was put out in some email communications was thousands and thousands of people looking at our food shelf map, looking for support and resources right away in March and April last year. And it really just was one of those early kind of warning signals that we knew if people were looking here, that it was just a bellwether of so much more need than was even showing itself in our kind of web visitor tracking. And so we've been in an ongoing conversation with the food shelves, and of course, everybody saw, and many people, even probably in this group, participated last summer after the murder of George Floyd and the uprising, and then the pop-ups that became really visible all over of emergency food response to community members, that what happened was things became visible that were there, right, that were behind the scenes, real dire need. But it was, I think, a learning period for so many people, that this wasn't just about the very, very difficult situation of grocery stores that were taken offline for a temporary period of time, but also that need that was previously there, that was, really exaggerated by the pandemic unemployment and by the additional impacts of the unrest and uprising, creating even more challenges on top of what was already there. But those pandemic impacts that really have continued to this day have been really supported by the resilience of the community that was already there. And here we had been working on developing with our community partners a food action plan to try to support a more resilient community food system, and we saw that, and in a heartbreaking way, but also in a really incredible way, how people were feeding each other, and how, when the city was really not able to step in, how our Black, Indigenous, people of color leaders in these communities were just opening their stores and their restaurants, and people were feeding each other. And so we've had ongoing conversation with the the pop-ups and the food shelves to try to understand what makes sense as a role of the city and where the needs are, and leveraging resources clearly are one of those ongoing ways that we can be helpful and listening and just, you know, showing up when invited, and really trying to you know, get the word out about how people can be helpful when there's projects looking for volunteers. And so on this website, the minneapolismn.gov/food shelves, we do have a on each of those clickable grocery carts a way that people can you know, find out how to get the hours for service and also how to give to these projects. And these are food shelves and a few pop-ups that have kind of become food shelves over these years, and these last 2 years now, I guess I should say, of ongoing work, that it's no longer a short-term intervention, unfortunately. A recent survey that we've been doing with our food shelves, I think about 87% going from summer into fall of those who've responded have indicated that they're either having more increase in the need they're addressing, or it's staying the same, with a very small percentage seeing a decrease. And that's on top of the, you know, 50 to 100 to 200% increase that folks were seeing last year in the community showing up. And when we look at different grocery carts on this map, we can understand that some of these sites are serving thousands of people weekly or monthly, and it's a need that is unrelenting for them. And so when we've asked them, there's a number of different products that they're really eager to continue providing to community, to do so, meeting all of their types of needs, not just food, as well as the financial support that helps them with the operating, such as staffing and keeping the lights on. Those are things that we're trying to provide grants with our limited funds to do, but we know that with our philanthropic community here, there's a lot of other people who may want to step in as well. So I will add that back last year, we did add a city-led and partnered weekly food distribution at Powderhorn Park originally, and we moved that to Corcoran Park just due to the space and facility constraints that we had. And that was really an acute response to learning about a need in that community that was being unmet by the other services available, and a partnership with community members and with the food banks directly. Myself and a colleague, Mariano Espinosa, together worked with those partners to be able to provide a service that continues now with the Sane Foundation, offering still a weekly Friday food distribution at the Corcoran Park. And really, that's not our business typically to lead a food distribution. So we did kind of sunset ourselves out of that earlier this year, but have learned such a tremendous amount just by being in the business of working with the food banks and with the community to try to meet the need in a culturally appropriate and dignified and responsive way through the seasons of the year. It is certainly no joke, all the challenges that one faces trying to get food and wait for food and source that in a way that is you know, really meeting the family's needs. And so having had the opportunity from the city to be able to take part in that project, there's just so much respect I have for the food banks who've shown up, and all of these community leaders who, as volunteers and with no real you know, benefit except to be able to serve their community, have continued to show up, not just there, but across the city. And I think, you know, you've seen this in the press, but not even enough to do justice to the incredible food justice leaders that we have here in our city, that we're just really trying to lift up in whatever way possible with resources and support. And so that's really the approach that we've taken, is listening and trying to help as a convener, coordinating resources, since we have some of those grass tops connections, and really can try to leverage resources and information to better those opportunities for those they're doing the work, and trying to just stay out of the way wherever that makes sense. Back a year ago, we did have the opportunity to distribute nearly $1 million in CARES funds for folks to build their capacity of the infrastructure of their food distribution, or to just purchase food to give away at that point in time. We're in the process now of finalizing about 1.1 million in contracts for food security projects. But unfortunately, we did an RFP. Our request exceeded 4.5 million. So what we have, through a combination of the American Rescue Plan Act dollars, the Center for Disease Control grant the city has, and a community development block grant, combination of together to get to that $1.1 million in resources, but seeing about 47 applications, which exceeded 4.5 million, and knowing that those were just the applicants who were able to put together an application in the time period that we had, with the constraints of applying for city funding, certainly a signal that the need really is so vast, and really working with our food shelf partners and with the those who are getting those grant awards to be able to tell the story of what we're doing with this funding and continue advocating for more resources. The county also put out a grant as well, and that was really focused on food. And what we are really glad our funding was able to do was support staff and food. And so what we see across the projects, these 13 projects that we're funding, is a combination of food shelves and meal programs, really culturally specific community interventions of food, and both the prepared meals as well as grocery delivery, to try to really address those gaps that we know exist, and that without some special additional funding for staffing or the right kind of food procurement was going to be hard for the community to really meet those needs. And as I mentioned, just that need clearly continues, but we are really glad that we can put these resources to action here with these 13 partners. And they are, I think, 5 in north, 7 in south, and 1 citywide, who will be reaching many different high-rise buildings for seniors in north and south and kind of around the city. And so through that project, meeting many thousands of community members' needs with food that is very much designed to meet their needs by their own input with these community-based organizations that we are going to be partnering with. And so bringing us to the Food Action Plan, this is a process that was launched with the Food Council as a partner, the University of Minnesota, and out of our office, originally in sustainability, moving over to the health department. Our partner, who was originally at the U of M, did move to Princeton mid-process, and so that brought Princeton into the mix, and we still have partners at the U, and so it's a pretty complex set of partners, but really the community is the lead on this, since it's a plan for and with the community, and with food justice as the foundation. And so our stated goals for this plan is really to be a roadmap toward a more equitable, climate resilient, just, and sustainable local food system and local food economy. We can't do that without knowing both what the research shows on greenhouse gas emissions and how our food kind of behaviors will affect climate or prevent some of that climate impact, but also if there is a conflict between what we may do and what the community really feels is needed, we need to resolve that. And so we are working with these food justice principles that the Food Council and community developed, as well as the research and the input we're gathering to identify goals, strategies, and then measures to help drive our action over these next years. And as a Food Council, this will really be the playbook for what the Food Council works on, as well as the city. We had a climate action plan developed that didn't really have a lot to say about food, except look to homegrown Minneapolis for the food action strategies. And what we had at that time was a pretty old food document from the Homegrown Minneapolis initiative. So we launched this effort to try to be an appendix to that city climate action plan, and it's taken a little bit longer due to the pandemic than we had originally planned, but we are close to the finish line here. We are actually right now in the process of looking for community partners to be willing to come on for about up to $2,500 for an organization, help us to ensure that we're getting input from the cultural communities of Minneapolis that are most predominant, and will probably be gaps if we don't have the partnership to really ensure that we've got that input. And so if any of you are connected with organizations or have recommendations on those who may apply, there is a link to put in a very brief application to be a partner through the University of Minnesota. They will be bringing those partners on board in the next couple weeks with a really kind of a rapid turnaround. And finally, there is a citywide survey that will also shortly be made available for input as well. And so really would love to send that to you all and gather your input across the areas of the food system, and really looking at what that resilient city looks like from the standpoint of public health, but also that food economy, and what the city may need to do to make more progress on this in the way that the city and the community can agree is most high priority. So looking to the first quarter of 2022 to bring that to the new city council and Mayor Fry to be able to work together with us to adopt and begin looking at implementation. So that's really all the slides that I brought, but very open to any questions or discussion the group may have about the food efforts, and I am happy to follow up with any information I don't have and could bring back.
Thank you so much for that wonderful presentation. Oh, there's a little echo. I can say, as committee members gather their thoughts, November being kind of a month of remembrance and looking back, this is a reminder, a good reminder of how fragile our food distribution system really is in the face of some emergencies. I recall, and I can't even believe that I kind of forgot, I was chairing the Nokomis East Neighborhood Association during the beginnings of the pandemic, and we applied to become a satellite distribution office for Second Harvest Heartland, and those weekly food distribution programs still continue to this day. So I greatly appreciate the work that you're doing, Tamara, and also appreciate that you're working to make it easier for other organizations who maybe don't have an executive director who is is very comfortable working with the city and other organizations in order to stand something up very quickly in a state of emergency.
Well, thank you for your work as well. It is a lot of hats that people end up wearing, and that type of volunteer time that really brought, like you say, food that's continuing today. So thank you for that. Yeah, I'm aware of that Nokomis effort, and just, yeah, really appreciate the way people stepped up all over like that.
So you mentioned closer to the beginning of the presentation that there were some issues that slowed down, I wrote this down, the greenhouse project. Now, were those issues isolated to that particular project, or are there systemic issues maybe in the city's makeup that worked to slow down the project?
I think that the pandemic has slowed down everything, just first and foremost for us and for those community partners needing to Food Action Plan, the Greenhouse Project, a number of our projects just really took a pause or a redirect, right? I think that in this case, actually, some of those partners focused on feeding their communities rather than building a structure, right? And so both Appetite for Change and Tamales y Bicicleta is really deeply involved in community nourishment and in the most kind of acute and direct ways. They could be AFC doing a lot of meal programs, changing their breaking bread space and an incubator kitchen to being a place for meals, so many meals to be distributed. And so their staff had to refocus, and so really also I think just a sign of how fragile nonprofits are as well, and how there's only so much capacity anybody has. And so when things are thank you, Margaret, acronyms, I will try to restrain myself from using. No, I think a lot of community members dealing with the trauma in the community and needing to take their own pace and time and deal with their own family and community immediate needs, and then really I think recalibrate the pace of the projects. And so learning, working at the pace of community doesn't always line up with the pace that the city or philanthropy may have and expectations. And I think I've seen part of my role is trying to help be that intermediary, and it's not always going to be possible or easy, but really if you want to make this type of a innovative effort to really work and take hold and take root, it's going to require stretching in some ways and being patient in ways that are not always what one may expect out of the gate. And so that's maybe ambiguous answer, but really it's been all of those factors. And I think I think where we're at, we've had some very difficult learnings together about all of the ways that if you don't build in enough money to maybe pay somebody to do all of your construction on the front end and your construction market goes crazy, thinking you're going to do something with some in-kind or with some affordable partnership on construction turns out to have been a false assumption. So we've learned a lot along the way too, and you can always build in a little extra on a construction project, but in this case, who would have thought the type of construction and kind of supply market that we are facing would be what it is? And so that itself has been quite a factor in this as well. And it's amazing when you live in a 4-season climate, the benefit of having a greenhouse, as well as the way the seasons keep turning and you find yourself in another state of the ground is freezing or thawing, and in times that you're really kind of trying to navigate. So all of these learning projects and being a team of just one plus an AmeriCorps Vista, we've tried to keep a lot of balls in the air and partners and have had a part-time policy aide kind of come and go throughout this time as well. And so really staff fluctuations, I would say, also due to the budget crisis that the city is facing were a factor. And I think I've been delayed in hiring a food security specialist. We'll be hoping to wrap that up soon, and that will really help. I think having some continuity of the work and the partners when we've had folks on an annual basis making new relationships every year. As you all know, relationships are central to so much of this work, and so having some continuity there, and honored to have been here for over 7 years now and be able to maintain some of this work just by virtue of being here all this time. So a lot of factors at play.
Yes. Well, hearing now about the size of your staff, wow, very, very impressive. I'd like to kind of redouble my gratitude for the work that you and your team, revolving though it may be, was able to do and continues to do.
Well, it's all about partnership, so appreciate that. So thank you so much.
So I am looking at the participants list and I'm not seeing any hands raised. Does anyone want to unmute and speak on this issue, either with a question or just a thought? Okay, seeing, Angela, okay. I saw you move your microphone closer to your mouth. Go ahead.
I was just formulating because I thank you so much for the presentation. I've been working on some food security initiatives through my job, and so you're really getting my juices flowing, and a lot of the focus of the initiatives that you're talking about, is around growing our own food and sustainability, and you mentioned the plots, and I think that's a really important component of a sustainable food and nutrition. Has the Minnesota Department of Health been looking at digital food security options? And by that I mean platforms that help people access food, because we're all kind of living in this world where we're not quite going out into the community as much as we were before with the pandemic. And so some of the solutions I'm talking about are apps that help people get signed up for SNAP, EBT programs. There's some API integrations with like Grubhub and things that would tell you like healthy food options to pick when you're ordering out, or grocery store price comparisons. So I'm just thinking about some other digital solutions along those lines.
That is really great to hear about all those different efforts happening. I think I would say that, we know the state's been doing great work on helping to bring the online SNAP ordering, and with the city trying to see what's the best role for us, really, when innovation can happen probably so much better and quickly in other venues, and so sometimes just showcasing those opportunities, or trying to help get resources or policy toward them. But for us, I think with the capacity we have, I think I absolutely agree with you that the accessibility of purchasing food or using SNAP or what to do that is something we know there's so much more progress needed electronically, and it's great to see a certain small number of retailers coming online with the SNAP online ordering system. But I'm very open to suggestion, and I would say that both through the Food Council as well as just through the other kind of informal ways that we show up in community, trying to understand if there is kind of an opportunity or a need to engage somewhere and help push something along is always of interest. And a lot of the work on growing was a result of the Food Council putting their effort there, but absolutely, as we've seen more of the hunger crisis across the community, we've needed to put our ears to kind of what other ways that the group should be involved on both the advocate or kind of on that project side. So I myself have been less involved there. It's less my area of expertise, but happy to kind of hear or show up, connect where there may be a benefit of the city having some involvement where appropriate. But yeah.
Great. No, thank you so much. And I'm happy to connect connect you with some resources I've recently been exploring, and just kind of, an idea exchange, so to speak.
Mm-hmm. That's great. One thing we do at the Food Council is we do presentations as well once a month at our meetings, and try to keep the group apprised on initiatives in the community and some kind of learning sessions as well. And so it'd be great to follow up and just hear more about what you're involved with, and or if there is a way to connect some dots that are already there. So thanks.
Wonderful.
Thank you.
Okay. Oh, Margaret, your hand went up and then down. Go for it.
Yeah, it's up actually. Hearing some of your concerns about what is going to happen with the lots that provide some of the urban agriculture. So two things came to mind. One is that I'm very excited to see that the food action plan is going to be an addendum or an appendix to the climate action plan, which for people that aren't haven't been as involved with this committee as long as I have, the PHAC early on was a big supporter of that climate action plan. So that's cool to see that, you know, I know it's been a long time in development, but that now these two things are going to get, you know, kind of married together. And then the thing I was going to mention about the food lots is, yeah, one of our former PHAC members was very active in trying to get the city to develop those things. And just recently, my husband and I watched a documentary on urban agriculture through the, I can't think of the name of the conference that he went to, but I'll include this in our meeting notes. It's called A New Economy. It's from 2016. It's available on Vimeo. And they really follow urban agriculture in like 4 different settings about what are those particular cities doing, how are they dealing with, you know, not only sort of gentrification, but, you know, development, loss of their property, and then, you know, sort of what the next steps are for them. So not every story is about that, but I remember there was a big piece about that in that particular documentary. So if you haven't seen it, I would highly recommend it. It's very watchable. It's not super heady, and it's about, you know, how the urban agriculture provides life-giving opportunities to people that have felt hopeless about a number of things. So yeah, I strongly recommend it, and I'll include it in our notes.
Thanks, Margaret.
Yes, thank you. Okay. Seeing no more hands. Thank you so much, Tamara, for coming and presenting with us and sharing all of this wonderful information.
Thank you for all your work. Appreciate it as well. Thanks.
Yes, hopefully you'll come back and present the plan once it's available.
Yes, would love to. And in the meantime, when we have the link to the survey, if it's okay to send it along to your group and try to help get your input, that would be great. Thank you very much.
Thank you. Okay, pulling up my agenda. Next, we have Gretchen's report. It's heavy on my heart. Your last report to the committee, Gretchen.
Yeah, to name these things like last is kind of dramatic, isn't it?
Yeah, I'm a dramatic guy.
Yeah. Well, yeah, so I will be retiring at the end of the year, and I believe there will be a gathering if anyone's interested on the 16th of December. We'll get some invitations out to folks between 3 and 5, I believe. So a few things that I wanted to mention in this report. One is that, as you all know, we've had an election in Minneapolis, and there are 7 new members on the city council. And many of the folks that we have worked most closely with on our public health and safety committee will no longer be with us. And so there is a real need to establish some new strong relationships, potentially with some of the new folks, or to re-energize relationships with some of the folks that are coming back. But yeah, people that I consider, you know, leaders for us in many of our concerns about environment, about public health, were not reelected or chose not to run again. So, and I don't mean to characterize this as because they were our advocates, you know, that they didn't do well or they decided not to run, but it is you know, something we need to face in the new year. Speaking of the elections, we're still sorting through just exactly what new structures and forums and relationships there will be because of the charter change that strengthened the role of the mayor as the administrative head of city government and more clearly defined the council as the legislative body. So that is all under consideration. I believe the mayor's put together a task force to help him think about, what are the different options and so on. One charter change that did not prevail was one that would have created a new department of public safety. Having that charter change not pass, I think, is not the same as there not being a continuing interest in looking at the way that we address public safety. So that will continue to be something of high interest and focus, and our Office of Violence Prevention will, of course, be a part of that. I know this group has been really interested in racism as a public health crisis. We have some staffing issues, both in the Office of Race and Equity, in the coordinator's office. They need to staff up again. They had a significant turnover. And we have a new opportunity manager of equity. I think that's what we're calling the new position with some new funding that we have. We are that's sort of in the field right now, and people can be applying right now. And so we will be looking to that person to help us. One of their jobs will be to help us kind of keep the plate spinning on this resolution on racism as a public health crisis. In this interim period, we have just sent out an email to folks in different departments that we call the process owners. So for each of the action recommendations, there were people or departments that were identified as kind of the lead on the follow through. And last June, we reported to council, laid out some general plans of action in each of those areas. And so we just sent an email out to folks to update that information, to tell us how they're doing on the timeline that was shared with council. And we expect that that information, once we gather it, will be something that would be of interest to the new council. And Council Vice President Jenkins has been reelected, and so she was a real leader on that. And so I think we can continue to work with her and think about how to move forward and make sure the city's making good progress there. The final thought that came to me for this report is, of course, COVID, and it just won't go away. We have really high rates in Minnesota. We're first or second in the nation in terms of our positivity, our number of cases per 100,000. We have vaccines, which we didn't have at the beginning of the pandemic. Other methods that we're using to protect ourselves seem to be less and less prevalent. So people are less likely to be wearing masks, to be socially distancing from one another, to be avoiding large groups for prolonged periods of time. So it's a really new, challenging phase. And we, of course, are promoting vaccinations. We are now able to offer vaccinations to people as young as 5. And there has been some acceptance of that. And of course, we also have the opportunity for boosters, which I would encourage now anybody who has been vaccinated more than 6 months ago, if it was with Pfizer or Moderna, more than 2 months ago with Johnson, to get a booster so that those of us that are vaccinated have the strongest protection possible. So all of that is important. We have been focusing on 5 zip codes within the city that had the lowest rates of vaccination and highest rates of infection over time. 2 of those 5 zip codes are at 75% having gotten at least 1 dose. These numbers I'm going to give you are at a little bit of a weird time because of the children who are just eligible to get shots and have only gotten 1 shot. So I'm going to tell you the 1 shot people as opposed to the 2 shot, you know, the fully vaccinated, just because of this weird space we're in. So 55404 and 55407 both have more than 75% of their residents have received at least 1 dose. And citywide, I think we're at 80, you know, close to 80%. So I think we're doing well as a city. And those 2 zip codes are doing pretty well as well. Then there are 2 zip codes that are essentially North Minneapolis, 55411 and 55412. 55412 is at a little over 62%, and 55411 is at 56%. So they're, eking up into good territory. And all of these zip codes, including the last one, which I haven't told you about, continue to increase their rates, but at very small, at a snail's pace. But anything is good. And so then the remaining zip code is 55454, and that's the Cedar Riverside area. And they have not yet reached 50% of their population with 1 dose. They are at 49.4%. So, yeah, so we have challenges. I was just talking about this with Noya today, and in many of the communities of color, word of mouth, example of your neighbor or your friend is some of the most powerful way of communicating the need to get vaccinated. I've been trying to pay as much attention as I can to what are some of the factors underlying various different groups that are hesitant or resistant. And I say it that way because there's just a lot of variety amongst those who are not getting vaccinated. And I think it's an ongoing challenge for us to think about how to connect with folks emotionally, because I think that is the important level that we need to be working at, so that we can help them move into vaccination if that's eventually where they're going to go. So those are the things that came to my mind. Happy to talk about other things or answer questions.
Thank you, Gretchen. My immediate takeaway is that Gretchen is having a party, and I am looking forward to that invitation. Kozar, you got your hand up?
I do. Really glad to hear about Gretchen's report. I think in regards to 55454 for Cedar Riverside, I'm wondering, what are the reporting mechanisms? Are we only looking at demographics? Is it adults and young adults and youth and kids? Or are we just looking at, adults that were qualified for the, vaccine prior to youth getting qualified?
Yeah, thanks for that question. We have continued to modify our denominator, if you will, based on who's eligible. And so, yes, originally we were talking about adults. Then we modified it and we're talking about 12 or older. And now we have modified it again and we're talking about 5 or older. So this number that I gave you today is based on the denominator of age 5 or older.
Okay, that's good to know, because I've been in the community, I've seen the outreach happening, but I also know that a lot of folks in the East African community are really concerned when it comes to vaccinations and its connections to, other challenges, whether it's behavioral challenges for young children or the connotation that vaccines cause autism. So that might be a huge concern that might be playing a role. But other than that, I've seen some huge turnout with M Health and their partnerships with the local mosques in the area getting elders vaccinated. But that 49% number is very concerning for me. So I definitely will try to figure out if the Health Commons work in the area or having up any like pop-ups, or if the Sea Rock Center or Brian Coyle are planning to have any. But yeah, thank you for that.
Yeah, and thanks for any ideas or energy you have to put into that. We appreciate that.
Further thoughts on the commissioner's report?
My final thought, just for those of you that don't know my history, there was a time when I was on the Public Health Advisory Committee and I was chair of the Public Health Advisory Committee. So this is a group that I have participated with in many different ways. Of course, I was not employed by the city at that time, but yeah, this has been a group that's been with me for many years. So love your work.
Well, thank you for your work. And, you know, oftentimes with public servants, they retire and then they seem to find something else to do. And so if the opportunity comes for you to present before the committee, I think we'd all really enjoy that. We'd love that.
Yeah, well, thanks for that invitation. I think of retirement as just a turning in my path. It really isn't an ending of a passion of life. So I'm sure we'll be working on stuff, and that's a great idea to think about coming and telling you guys about it. So I don't know what that will be, but thanks for the invitation.
Thank you, Gretchen. Okay, next on the agenda is new business, and I think, Margaret, you've got the next couple of bullet points. First, you've got an update on City Council, what that means for Public Health Advisory Committee members and department staff.
Yeah, and that really dovetails nicely with the report that Gretchen provided, just to give you some specific names. So there is a handout that was provided in the agenda that just gave like who the new elected council members are, what wards they're in, and who was the previous council member, because I just think, even for me, I sit there and I think, oh my gosh, like now I have, again, of course, a new set of people to memorize who is representing which ward and who is the PHAC member that's attached to that ward. I do want to, I guess, reassure people on the Public Health Advisory Committee that your reappointments for anybody that had applied for a reappointment will be going through on the last Public Health and Safety Committee meeting, which is on December 2nd. So what, in my experience, what I've found is that the outgoing council members do want to make sure that their representatives are appointed in that, you know, preferably before the end of the year. We do have, and I wonder, oh yeah, we will have a new Minneapolis Public Schools representative who happens to be listening in on our meeting tonight. So I'm, not to put you on the spot, and I think you say your name, Swad, maybe, if you want to come off mute and just introduce yourself ever so briefly. Wanda Felder is going to be going off of the committee, and I see that she's here as well, but we will have a new Minneapolis Public Schools representative as well. And then a little later in our agenda, we'll be nominating or reapproving our member at large, as well as a selected member from the School of Public Health. So I guess I have one more thing to say is that taking Gretchen's point really to heart is that when new council members begin, I do think it's very important for Public Health Advisory Committee members to introduce themselves to the new council member if you don't know them. It can easily be done through email. I will make sure that you have the emails not only for the council members, but also I've found it very effective to get their aide as a CC on the email, because a lot of times the aide is the is not the gatekeeper, but is somebody that helps sort through and prioritize the emails. But most of the council members, as you know, have a web page. You can contact their office through that. There will be a lot of things that the new city council has to do. They'll have to organize themselves, figure out what topics go under which committee names. Like currently we report to the Public Health and Safety Committee. Previous to that, it was the public health, environment, civil rights, and community engagement, I think. So the Peace Committee. So, there's a lot of organizational things that need to happen right at the very beginning of the year. But one of those things is just introducing yourselves and, keeping it brief so that they just see your name, what committee you're with, and maybe a couple of the things that are really hot topics for you or priorities of the committee. So, and then you can just say, looking forward to, communicating with you further, and leave it at that.
Good call, Margaret. Members, please do email your city council person. But then also, Margaret, you invited Swad, possibly mispronouncing your name. I apologize if that's true. And I saw them go off mute for a second. I've got eyes like a hawk for those mute buttons. So just another maybe 10 or 15 seconds, Swad, if you're available and want to introduce yourself. If you go off mute, then I'll know that you do. And if you don't, then I know that you don't.
Thank you, both of you, for introducing. My name is Suad. I've been working for Minneapolis Public Schools for the early childhood screening department anyway, since 2017. But I've been with the Minneapolis for a while, since 2012, I think. I've been going around position here and there, but I am in my third year in grad school with St. Catherine's, doing my public health master. That is something I was recently interested in. Also working with Minnesota Department of Health to do environmental exposures and things like that through children's. So I've been very interested in listening tonight. So I kept my camera off today because I'm not really ready to be on camera tonight. So
no
thank you.
worries at all. Thank you for joining us. I'm in a new house and I don't have my whole setup. So by the time you're in next year, it'll look like a fancy Zoom background in here.
Right. Thank you.
Okay. Let's see. Margaret, did that cover the impact of legislative change on the city governance structure from the agenda? Okay.
Yeah, that also was just a handout to kind of go along with Gretchen's report on, the changes that came with the November 2nd election, that the mayor, has more power, what is available on the city's website for you to look at. So there's some links in that document that will take you right to the pages in the city's website to be able to see, well, what is the structure going to be? Who is the health department, reporting to? And obviously there will be a little bit more fleshed out, by the mayor, and a governance committee or something they're calling it. I think a governance structure work group is being developed to pull together some information, as well as maybe even some recommendations about how the mayor may choose to restructure the government, the city government. So more to come, but I just wanted to make sure you had the resources at your fingertips so that you could educate yourselves on what that means.
Thank you for putting those together. I found this to be very helpful attachments. Next, we've got certificates of recognition for outgoing members. And the first certificate will be for KJ Starr, who I believe is not here today. Am I remembering that properly? And then I don't know who is going to read KJ's certificate.
KJ, that's me.
Okay.
Sorry, I was looking for my cheat sheet. I was like, I printed it out so I would have it available to read. Where is it? Okay. So each year when we have outgoing members, we provide a certificate of recognition because obviously we know that you are volunteering your time every single month, bringing your expertise and your energy and even your tired selves to the work of the committee, you know, every month. And it's so appreciated that we started doing this a number of years ago and feel that it's just one small way that we can say thank you to you. So I'm going to add in Wanda Felder as well. So her name didn't make it onto the agenda, but because we're just reading this information, it isn't a handout or anything, we can just read it. So for KJ Starr, a certificate of recognition is awarded to KJ Starr for her years of service on the City of Minneapolis Public Health Advisory Committee as the Ward 2 representative for Councilmember Cam Gordon. KJ brings a wealth of knowledge and experience to every discussion, action, and recommendation. Her credentials include data, legal, and policy analysis skills, and life experiences as a low-income person, landlord, restaurant owner, and as a parent of children impacted by lead poisoning. KJ served as the Ward 2 representative for 6 years, from 2016 to 2021. During her tenure, the committee provided feedback on the state health assessment, recommended the creation of a housing advisory committee, and supported ordinance changes for paid sick and safe time, increasing access to healthy food, and reducing access to tobacco products. The city hosted the Super Bowl, Final Four, X Games, and experienced the impacts of the murder of George Floyd and a global pandemic. She is a fierce advocate for preventing the lifelong impacts of lead poisoning on the children of Minneapolis and helped to develop guidelines to eliminate childhood lead poisoning in Minneapolis. Additionally, KJ strongly advocated support for the City Council's declaration of racism as a public health emergency. So KJ, if you're out there, if you're listening to this on YouTube, then we just want to say thank you.
Wonderful. Forgot about the X Games. And then I believe you said Wanda's certificate is next?
Yes, Wanda's certificate is going to be read by Laura.
All right. So this is a certificate of recognition awarded to Wanda Felder for her years of service on the City of Minneapolis Public Health Advisory Committee as a member representative for the Minneapolis Public Schools. Wanda joined the Public Health Advisory Committee 2 years ago as the member representative for the Minneapolis Public Schools. Her credentials include, and they're impressive, 30 years of experience working in early childhood education and care with Minneapolis Public Schools, YWCA of Minneapolis, and the Minnesota Visiting Nurses Association collaboration with the Minneapolis Health Department Healthy Start program. With each role, Wanda is committed to the health and well-being of young children and their families by working for equitable outcomes, providing whole family supports, facilitating programs in community organizations, bringing early childhood screening to community sites, and providing education and care. During Wanda's tenure, the city experienced the impacts of the murder of George Floyd and the global pandemic. Wanda was a strong advocate for supporting the council's declaration of racism as a public health emergency. Thank you, Wanda.
Thank you, everyone.
Okay. Next, we have the certificate for Craig Hedberg.
So that's my privilege to read that one. Craig, good to be looking at you while I'm reading this. So this is a certificate of recognition awarded to Craig Hedberg for his years of service on the City of Minneapolis Public Health Advisory Committee. Craig served as the University of Minnesota School of Public Health representative for 6 years from 2016 to, is that right? Yes, 2016 to 2021. His background and expertise in environmental health, epidemiology, and food safety proved to be an invaluable resource for committee discussions, learning, and in making recommendations to the health department and city council. During Craig's tenure, the city hosted the Super Bowl, Final Four, X Games, and experienced the impacts of the murder of George Floyd and a global pandemic. Significant committee contributions included supporting ordinance changes for paid, sick, and safe time, increasing access to healthy food, and reducing access to tobacco products. Committee recommendations to City Council included environmental and health impacts of using recycled tire mulch in Minneapolis parks and playgrounds, the creation of a housing advisory committee, and guidelines to prevent childhood-lead poisoning in Minneapolis. Craig was a strong advocate in supporting the City Council's declaration of racism as a public health emergency. Thank you so much, Craig. And that is just an amazing amount of work to remind ourselves about that occurred over 6 years. So thank you.
Well done, Craig. Okay, and then the final certificate to read out is for Laura Rangard, and I will be reading that one. Laura Rangard for her years of service on the City of Minneapolis Public Health Advisory Committee as the Ward 11 representative for Council Member Jeremy Schrader. Laura served Ward 11 with a calm, consistent presence that invites people into conversation, a skill that served her well as co-chair of the Public Health Advisory Committee. Her background includes 19 years of service to patients, families, and communities in the healthcare industry in various roles as a professional nurse. Her experience in quality and improvement and broad system and process improvement added breadth and depth to committee learning, discussions, and actions. She was involved in committee actions to prevent the lifelong impacts of lead poisoning on the children of Minneapolis. Public Health Advisory Committee members formed a subcommittee to study these impacts, identify the most affected areas in homes, and create a set of guidelines to eliminate lead poisoning, which were presented to City Council. During Laura's tenure, the city experienced the impacts of the murder of George Floyd and a global pandemic. Laura was a strong advocate for supporting the council's declaration of racism as a public health emergency. Thank you very much, Co-Chair. Great job. Okay, switch back to the correct tab. Margaret, we now have the approval of a member at large. Did you want to read on this background info? I can do it if it's just reading. Background info. Anjali Punjabi was appointed mid-pandemic into the middle of a 2-year term. Therefore, she will begin a new 2-year term in January 2022. The Public Health Advisory Committee approves the appointment of a member at large and sends the name forward to City Council for appointment. So will that require a roll call vote, or can we just wiggle our hands up in the air in unanimity?
A roll call vote, so an official nomination to that seat and a second, and then a roll call is required.
Okay. Is there any discussion on the nomination? Okay. Alicia, would you like to move that we approve Anjali Punjabi for the position?
Yes, I move that we approve Anjali Punjabi as an at-large member for the 2022 to 2023 PHAC seat.
Nicely moved. Nicely moved. Laura, would you like to second?
I'll second.
Wonderful. Hattie, will you please call the roll?
I will. KJ Starr. KJ ever join us? No. Mary Pike.
Yes, approved.
Kozar Mohammed.
Approved.
Lisa Nakotra.
Approved.
Alicia Jackson.
Approved.
Laura Rangard.
Approved.
Jerome Evans.
Approved.
Andrew Kirk.
Approved.
Britt Culp.
Approved.
Wanda Felder.
Approved.
Meredith Martinez.
Approved.
Greg Hedberg.
Approved.
Babette Apland.
Approve.
Aaron Hurley.
Approve.
Do we let Anjali vote?
Oh, yeah.
Okay, that has been moved and carried.
Wonderful. Congratulations. Okay.
And we also have a nomination for the School of Public Health member. So I think Alicia is going to handle that one.
Wonderful. Take it away, Alicia.
Okay, so myself and a few other members of the PHAC committee interviewed 2 candidates from the School of Public Health. And throughout our interview process, we deliberated and decided to put forth the nomination for Twee. She is a public health graduate student doing her PhD. She's worked for a public health department down in the state of Alabama, currently works in food science and environmental health. She spoke at great length about her insights and experiences in the healthcare system, both as a first-generation student going to college and having 2 parents that don't speak a large amount of English. It seems that she's very committed to the idea of racism as a public health crisis, in addition to well-rounding out perspectives and ideas that I think would be helpful to the committee. And so by all of what I have said, as I stated before, we are putting forth the nomination for Twee to be the representative for the 2022-2023 season for the seat at the SPH.
Thank you, Alicia. And because this is a member representative or a representative member seat, we don't actually have to take the vote to do that because it is really the university's decision as to who serves on this committee. But because we had 2 excellent candidates, Craig had wanted the committee members, and then Noya had participated as well, to do an interview to make sure that the candidate that was put forward as a recommendation from this committee, was a good fit, perhaps filled a gap, or perhaps filled out the committee in other ways. So that was some of the deciding factors that went into recommending Twee join the committee. So Craig, now you know.
Thank you. Twee is one of my PhD students. She's got a lot of energy and is a hard worker, and she's going to fit in really well with the rest of you.
Fantastic. We like energy and we like hard work. So that's great. That's great. Okay. Next we get to a call for interest in being a committee co-chair. Margaret, did you have any insights into this one?
I should ask Laura if she has any insights into this one. As the outgoing co-chair, Laura, you certainly can, make a pitch, provide some insight, maybe something that you've learned about the committee, but basically, the call is just that, with Laura going off the committee at the end of the year, it creates an opportunity for someone to step into that co-chair position. And then I'll just reiterate that the co-chairs are intended to rotate. So next year we'll be looking for somebody probably about mid-year, end of the summer to take the place of Jerome, because Jerome will have served as a co-chair then for probably 2 years. And so the intention is that we actually do have kind of a rotating co-chair position so that there's someone who has served for a while as a new one comes on board. And then when that person that has, some of that co-chair experience goes off, then another new person comes on. So we try to avoid having 2 new co-chairs at the same time, if at all possible. So Laura, what would you like to add about being a co-chair?
I think it was a great role for me just because I got to learn a lot more about the city and how things work and different people that we're connecting with in order for this council to kind of get the right information, and knowledge about some of the key issues. So I think it gives you a lot of good behind the scenes. Certainly if you're looking for an opportunity, to grow into a role, I think it's a great, you're very supported. So Hattie and Margaret take excellent care of you. So you aren't kind of out there on your own searching. They certainly wrap around well and keep us organized. So I think that's a great way to venture into a role like this because you have good support. Certainly, I would love to continue it if I wasn't quite so burned out in my healthcare role. Otherwise, I think it's a great, again, it's a really great group. This is such a dynamic council too. So I think this membership is just excellent right now. So I think it'll be a fun group to support. So I think that would be another advantage I would see for a term. And Jerome's such a fun partner. So I would just say that would be a strength also. So.
Yeah, the word fun can be interpreted in so many different ways. Wonderful. So what is our process going to be, Margaret?
Yeah, so basically, if you are feeling called to step forward as a co-chair, please let me know. You can let Jerome know. You could let Laura know, because she's still on the committee until the end of the year. What we'll do then is for anybody who has either volunteered or if you want to recommend someone, because sometimes that's how a co-chair has been approached, is that someone makes a recommendation that, hey, I think, so-and-so might be interested, can you connect with them and see if, they actually are interested in serving in that role. So it can be through, recommending someone to me or through stepping forward yourself. And then we would try and connect in December with any of the folks that have stepped forward, just so that people know, well, what does that really entail? What's the time commitment? When do we meet, in between the meetings, et cetera, so that at the January meeting, then we would actually elect a co-chair to the committee. So you got a little time, but don't hang on to that raising your hand for too long, because it is nice to have a little pre-New Year, meeting of the minds, so to speak.
Agreed. And if you ever want to put, chaired a committee of public health professionals during a global pandemic on your LinkedIn resume, this is probably the only time. Yeah.
Fingers crossed.
Okay, then moving to what I believe is the last item on the agenda. Committee logistics as we close out this year and get ready for 2022. And this will be pretty open, pretty freeform. The one thing I will note is that at the conclusion of our last meeting, a couple days later, the Racism as a Public Health Crisis Subcommittee sent a fantastic letter to Gretchen. And I was like a proud committee co-chair, because obviously I'm very passionate about that particular subcommittee, but I stepped away. And while I was gone, the subcommittee did amazing things. It was probably the happiest I've ever been to get an email on my phone. And so as that continues, as our work continues to grow, there are certain things we have to just be mindful of. For instance, we do need to copy Margaret on those types of emails so that she is not blindsided by her boss. And the like. And so, Margaret, if there are any other kind of similar to-dos or things to think about, because as you've mentioned, we've been doing this for so long now that I've kind of internalized the routines, and so I haven't had to articulate them in a while. So if Margaret, if you have some thoughts, and then I see Britt's hand is up as well.
Yeah, I'll let Britt go first, and then I can respond after that.
Awesome.
Yeah, I just had my hand up because I did reach out to, because I think it's still called Food, Drink, Medicine, but again, I'm going to put it out there that a name change for that subcommittee might be more appropriate. I digress. I did reach out to Southside Harm Reduction about safe consumption stuff. And Jerome, if you want me to forward that conversation to you, I'm more than happy, or we can connect offline at some point if you want to set something up. But they are interested in if we wanted to have them come and speak to the committee next year in 2022 to discuss what all that they do, kind of what areas in Minneapolis mostly that they do cover when they go out, in terms of when they engage with the in-house population, just to do general outreach, but also more within the elements of working with people who use drugs, where the syringe service programs, naloxone and all that, any challenges that they are facing, that where it might be nice to get more of an advisory committee support, but also loop us in on anything that's exciting with the Bush Foundation grant that allows them to explore what a safe consumption site would look like in Minneapolis.
I would say kudos, fantastic. Thank you for reaching out to them. Don't feel, everyone, as though you have to copy me. Do feel as though you have to copy Margaret, I think would be the best rule.
I only mentioned you because you were in the same group as me last time and I took it on. But yes, Margaret, if you'd like, let me know when you want me to forward you that email conversation I was having with a couple of the folks at Southside.
Yeah, that'd be helpful. And it's not so much that like I'm the gatekeeper per se, but a lot of times what happens is that either topics come up and then I hear of other things that are happening within the health department, and I can help make some of those connections either internally to the health department or also to sort of the city enterprise. And Britt, I know you're very connected to kind of city enterprise folks as well, but it's sort of those, it's good for me to be in the know about what you all are thinking, because then I can also help garner resources, or even in the case of, of Southside Harm Reduction coming and giving us some information, then it gets our brains going like, well, is there some other aspect, that we want to make sure is, talked about or covered, and things like that. So
right, and they do a lot more work just outside of syringe services, because they also do HIV testing and incentivizing that. So they're tackling the HIV outbreak in the midst of still doing frontline services in a global pandemic. And also I'm not sure I'm as connected with the inner working as many people with the inner workings of the city as I was a few years ago, but I forwarded you just kind of the cliff notes or a couple of emails back and forth, Margaret, just so you can look at it and then we can connect on it further if you'd like to.
Yeah, that sounds great. One of the other things that I guess I would offer to people, if you're interested, is, I always like to do sort of a warm handoff to people. So again, not necessarily that I am the only conduit of information, but, with our new council members coming in, if you would like for me to sort of do an introduction, because it would give us a chance to introduce the health department, to the new council member too. I could always do that, is create kind of a basic boilerplate, for lack of a better word, that just kind of summarizes some of the PHAC actions in the past, as well as maybe things that are currently in the works, as well as name a couple of our priorities. And then say, and oh, by the way, this person actually represents your ward, blah, blah, blah. So I'm like a big fan of that kind of warm handoff, and I'd be happy to help facilitate that as well. I think going back to that idea of me just knowing sort of what's going on, that was sort of the relationship I had with Gretchen early on, is that everything that I did with a council member got, either CC'd to Gretchen or CC'd to my immediate supervisor. And then once I think that, relationship had sort of developed a little bit more, they were pretty confident that I was going to be able to, sort of initiate those conversations on my own. But it was really helpful to have that sort of feedback too, is that it's like, well, maybe you should say it this way, or I don't know, that, that's the person that you want to go to. Here's a better contact, so again, going back to that idea that it's helpful for me to be in that loop so that I can be helpful to you, because that's my goal, is, to help you all look good, and you look good from here. So I want to keep that going.
Great.
Yes, it's wonderful. I just want to reiterate, a CC is what we're asking for. We're not performing a gatekeeping function.
Oh, so, yeah.
And Julie, if you want to reach out to Tamara for an idea exchange or what have you, feel free. In that case, a CC would just be nice, just to be nice to see the ideas in case anything ever triggers in the future. Cool. Also, Margaret is kind of the keeper of the schedule for presenter, who's presenting when. She'll move someone from February to June if something else comes up that's of more interest to the committee. So also very useful for that. If you would like your presenter to know how to present to the committee, if you'd like for them to be on the agenda, you'll definitely want to make sure that Margaret's in the loop.
For sure. Yeah. And that's extremely helpful because, once upon a time, and I don't know, Gretchen, what the committee was like when you were on it, but yeah, the committee used to hear like 2 presentations every committee meeting. And I was just like, when does the committee actually do its work? Because that seems like a lot of information, that you and I don't necessarily know about. And, to like open up the top of your head and just pour in all that information, it just seemed like, well, when are they digesting it? So, so pretty early on, we went to the idea of, no, if there's going to be a presenter, one presenter, then we have time to actually digest the information that we've heard and maybe even establish like, well, what would we do, perhaps, the next meeting. That's also where co-chairs are helpful, is being able to figure out sort of that arc of the work. So that's really what I see my planning role is in helping you all to exercise your priorities in a way that, keeps those priorities moving forward, but also helps to make sure that, the various priorities have, sort of equal play.
And then speaking of continuing to move things forward, I know you all want to meet in December, and I pitched it as subcommittees, if you could have unofficial meetings or something, and I got the kibosh. So unfortunately, I have to ask that you do not work in any kind of public faculty on your work. Like, don't go on teams together. Don't have anything with an agenda. But if you want to send emails back and forth to each other, that's good stuff. That'll work. Okay. And then
informal conversation. Yeah, informal. No, if we're not publicly meeting, you can't really conduct business, during the course of a month where we're not having a public meeting. And we have to, oh my gosh, I lost the word. Anyway, we have to obey. That's not the word I want. Conform. We have to conform to the open meeting laws, which is about transparency in local government, or state government. So we want to make sure that we're not conducting business that the community isn't aware of, or that the public can't participate in. And so that means for us, like, we really won't meet during the course of December. And that was a committee decision that was made a long time ago, I think, just because of the timing of the 4th Tuesday, is often in the thick of things that are going on socially, communally, in the community. We tried rearranging meetings, and that was, with some marginal success. And so it's not that that's a hard and fast rule, but I think it has provided a little bit more opening for people at the end of the year, just to take a pause, and to be able to appreciate the people around them.
And I just want to end, I think, that's probably the last note, by saying we're only having this conversation because you're doing such a great job. You're doing wonderful things, and we don't want the city clerk yelling at you. Make sure the clerk is yelling at us. It's fine. Don't be the one that gets the yells. Now I think
it's fine.
Unless there are any final thoughts, I'd love to give you 10 minutes back as a Thanksgiving gift from the co-chairs.
I hope you all have a wonderful holiday season, whatever or despite what you celebrate, and I look forward to seeing most of you back in January.
Yeah, I'd say you could come off of mute and let's all say our goodbyes.
Yeah, please do not nominate me as a co-chair quite yet. Margaret, Hattie, and Jerome kind of know, like, I'm not in a place for any of that, so please.
We got your back there, Britt.
Yeah,
much appreciated.
Happy holidays.
Have a good one, everyone. See you in January.
Happy
Thanksgiving.
Thanks, everyone.
Thank you.
We will see you in the new year. And Gretchen, thank you so much for all of your work over the years.
You're a rock star.
So appreciated.
My pleasure.